Scleral lenses are a fantastic tool in our toolbox of contact lens options. As with any contact lens, they offer very unique benefits for our patients, but they also have some very unique challenges. Following the establishment of an appropriate sagittal depth, we next need to focus in on where the lens settles onto the eye. Scleral lenses are much larger and have significantly more mass than corneal lenses. They also have increased sagittal depth, which creates an additional pressure from the movement of the upper lid. For this reason, it's important to have a proper fit characteristic towards the edge of the lens. As with anything that creates pressure, it's helpful to distribute the weight of the object across the larger surface. With scleral lenses, it's ideal to have a similar concept. By distributing the weight of the lens as evenly as possible across the conjunctiva, the lens will fit more optimally. When assessing the landing area of the lens, there are two potential fitting challenges that may arise: compression and impingement. Impingement of the lens is when the very edge of the lens is digging in or pinching into the conjunctival tissue. Compression is when there is excessive pressure on the conjunctival surface that results in blanching of the conjunctival vessels. It's commonly seen when there is excess edge lift or increased pressure adjacent to the edge of the lens. Resolution of each of these can be done by altering the landing zone of the lens. By increasing or decreasing the edge lift, the weight of the lens on the eye can be more evenly distributed. With a lens that demonstrates impingement, increasing the edge lift will bring the edge of the lens up, preventing the conjunctiva from being pinched at the edge of the lens. With a lens that demonstrates mid-peripheral compression, decreasing the edge lift will bring the edge of the lens down, allowing more landing area to be in contact with the conjunctiva. If compression is observed with impingement at the end of the lens, then increasing the edge lift will alleviate the excessive pressure on the conjunctival surface. All of these strategies aim to allow for a more even distribution of the scleral lens along the conjunctiva and underlying sclera, thus optimizing the fit characteristics. Following proper sagittal depth, evaluation and management of the edge of the lens is the next critical step. If a lens is showing compression on the eye or causing too much impingement in the conjunctival tissue, a simple alteration of the periphery and edge lift can be made to optimize the fit. If in doubt, your laboratory can help you determine the optimal changes for each situation. Thank you for joining us. I hope this has been insightful for managing impingement and compression with scleral lens wear.